How do population studies measure mortality and life expectancy? Breaking news in the world of public health. The question on many people's minds today is, how do population studies measure mortality and life expectancy? With recent discussions around health data and the impact of various factors on our lives, understanding how these measurements work is more important than ever. Population studies measure mortality and life expectancy using demographic data collected from various sources. This includes vital statistics, surveys, and health records. The focus is primarily on death rates and survival patterns within defined populations. Mortality is typically measured by calculating death rates. These rates representing the number of deaths in a population over a specific period. They are often expressed per 1,000 or 100,000 individuals. There are several types of death rates. Crude death rates count all deaths regardless of age or cause. Age-specific death rates focus on mortality within specific age groups. Cause-specific death rates isolate deaths due to particular diseases or conditions, such as cancer or influenza. Data sources for these calculations include death certificates, national health databases, and surveillance systems that track causes of death. These systems also capture demographic characteristics such as age, sex, and ethnicity. Life expectancy, on the other hand, is estimated using life tables. These statistical models summarize the mortality experience of a population. Life tables use age-specific mortality rates to calculate the average number of years a person can expect to live from a given age, often starting from birth. The process involves collecting mortality data by age and sex. These mortality rates are then applied to a hypothetical cohort to estimate survival probabilities at each age. By summing these probabilities, researchers derive the expected remaining years of life. To compare mortality and life expectancy over time or between populations, rates are often age-adjusted. This adjustment accounts for differences in age distribution, allowing for fair comparisons. Advanced statistical techniques, such as regression analyses, are also employed to detect trends and changes in mortality rates over time. These analyses can reveal how demographic factors like sex and ethnicity affect mortality. For example, recent studies have identified shifts in mortality trends for specific causes, such as suicide or cancer, among different population groups. In the United States, these measurements are critical for monitoring public health. They guide policy and help allocate resources effectively. Data from sources like the Centers for Disease Control and Prevention's National Center for Health Statistics provide ongoing updates on mortality and life expectancy patterns. These patterns reflected the impact of health interventions, emerging diseases, and demographic changes. Understanding how population studies measure mortality and life expectancy is essential for grasping the current state of public health. Stay informed as new data continues to emerge, shaping our understanding of health trends across the nation.